My name is Danyelle. I'm a member of the Depression and Bipolar Support Alliance Young Adult Council, and I'm here today to talk about getting treatment. So we all know that when you are physically sick or not feeling well, you go to your doctor, your primary care practitioner. But what happens when you're struggling with something in your mind? Well, there's a doctor for that too. I want to first say, thank you and kudos to you if you're recognizing these signs and symptoms and you're wanting to reach out, because acceptance is difficult, but it's really, really important first step. So you're like, I'm not feeling right. Something's not right. I'm not happy. I'm functioning differently. I'm struggling in my ability to live, laugh, and love and go to work and things like that. So now what? So the first thing to do is knowing your options. Just like you can go to a primary care practitioner for your body, it's also a great place to start to ask them about some more information about your mind as well. And typically they'll probably send you a referral to a mental health professional, or you can call your insurance company or go online and ask them for a multitude of other resources. But hopefully then they'll link you to a mental health professional, and they work in different settings. So it could be a community or a county mental health center, or it could be a private practice, and it could include different people. So it might be a psychiatrist, which is a brain doctor. It could be a psychologist, a social worker, counselor, therapist. There's all these different professionals, but you can find out who that person is that's right for you. And that's the most important thing about this whole thing, is being your own best advocate. So, finding the right person, finding the right place, having the right time. So whatever is that fit. So once you find that person that fits, the second piece is, what is that treatment that fits? And I always like to say different stroke for different folks, because each person is unique. What works for you might not work for me. We need to kind of make sure that we're on the same page and we get the best help for that person. So for most people, a combination of medication and psycho or talk therapy is kind of the common denominator or treatment modality. And why that works is because medication helps deal with those chemical imbalances that are in your brain. So it's not like this, I'm a bad person or I'm not worthwhile or anything like that. No, there's something in your body physically a lot of times that has been changed and challenged. So the medication helps balance that out. But then that second really important piece is the idea of therapy. And, being in therapy, the medication helps kind of refocus your thoughts and balance your moods. But then the therapy really helps you process things and walk through them and learn some coping skills that you can use whenever you're experiencing those things. And some other things also include things like support groups. Those are great. DBSA has chapters and support groups both in person and online. There's peer support. So DBSA also has peer specialists that are trained people that have mood disorders that can help other people by using their experience. But also really educate yourself, educate others, and take care of yourself. Self-care is incredibly important. One really cool thing that DBSA has is called their wellness tracker. If you can see this here, it says a dashboard, and it's got, your well-being, your symptom tracker, lifestyles, medication, health, and you can actually track what's going on in your life. Are your moods fluctuating? Did you take care of yourself that day? Did you watch what you ate or exercise or things like that? So these little tips and tools are really, really great. DBSA has some great resources. And the most important thing is that if you or yourself, or someone else is ever going to hurt themselves or someone else, it's important to get help immediately. So call 911. You can call 1-800-273-TALK, which is Suicide Prevention Lifeline, or text DBSA to 741-741, which is the crisis line. And there also might be local crisis centers in your community. So whatever you do, just make sure to take care of you, body, mind, and spirit, whole wellness, and you're doing the right thing. Getting help, it's okay to not be okay, but you don't have to stay that way.